Good afternoon. Today is Wednesday, July 8th. Let's get right to the numbers. Right now, on Wednesday afternoon, we have 47 patients with COVID in the hospital. A week ago when I did this video, we hadn't yet reached our prior peak, and the prior peak was 36. And so no question, if we'd like to do the mathematics, that the percentage increase is high over last week, high over the peak. It's high over the last 3 weeks. But I think the important piece for us to have in context, not only are the percentages pretty dramatic, and the mathematics would tell us that there's some real big increases. It's 47 patients. 47 patients have families. 47 patients are real people that are struggling through this. And we know how many people have gone home after COVID, and that's a bright star. That's encouraging, knowing that people can make it through. And so certainly I know for sure that the clinical teams taking care of the COVID patients recognize that. They realize that there's a ton of hope and optimism. But out of the 16,000 of us, the 11 in the hospital, the 5 in the medical school, I do recognize that there's a preponderance of us that don't take care of the COVID patients directly. And so it's pretty important to me that we remember that these aren't rates per se, that these aren't numbers per se, that there are real people and real families. And I know that everybody taking care of the patients and the rest of the UF family does care about each one of those. And if I take the number thing to another level and just talk about surge, or talk about capacity, or talk about the breaking point or not the breaking point, 47 patients for a hospital of 1,100 beds. I think we would all talk through the mathematics and recognize that that's a small number in comparison to the capacity here. And for those of you that are working in areas that are full or busy or working past capacity, you wonder how much more. But I don't think it's a how much more question. I think it's when we're really busy, there comes a point where there is a replacement. And so a place like UF Health is a referral center. Patients come from all over. We could theoretically think about slowing down transfers. We could theoretically think about slowing down elective procedures. We could theoretically be in a world where we're offloading patients to other facilities. We're not anywhere near there. Today's census was in the low 800s. Back in January, February, we were topping out around 920. So we're ways away from where we were busy in January, February. So it's not a concern. But appropriate and diligent planning means just that, appropriate and diligent planning. So we should and are thinking through all those various scenarios. So know that as we watch the numbers across the state fluctuate and vary, and as we recognize the reality that the numbers in Gainesville, in Alachua County, for patients in our hospital are low compared to, and you pick the big city, whether it's Jackson in Miami, Tampa General in Tampa, Orlando Regional in Orlando, their numbers are much more. Their numbers are bigger. They're dealing with something different. We have a different set of facts, and we should have an awareness of the facts, but have some diligence in thinking through how we would manage a resurgence, a bigger resurgence. And we're doing a lot of that. Along the way, we do have to stay disciplined to a few things. Discipline number 1, masking. Masking. Let's keep it front and center. Today, we have 130 of our colleagues, people that you and I probably know, that are in isolation at home because they're COVID positive. And as I mentioned last week, when we do the tracing, there's an overwhelming number of people that got it out doing stuff. Going to bars, going to parks, going to weddings and graduations. And again, as last week, I can't tell you to not do those things. But I do suggest to you, be thoughtful about masking, be thoughtful about distancing, be thoughtful about considering inside versus outside venues. More and more of our colleagues are going out in isolation. And that's going to cause an impact on us, not only in the workforce, but we have to rethink policies about what is the return to work after exposure, what is the return to work after positivity. And so we're going to keep working through it, and hopefully you recognize that there's some fluidity to this, that policies will be in place for a period of time, but maybe forever. Policies will be in place for a period of time, but maybe only for a short period of time. There is a lot of fluidity. And so just keep an eye out to the latest and breaking bulletins we send out, because that's how we'll share information. And looking at those bulletins will make sure that you're up to date on the most current. So for example, for a while now, for several weeks, maybe even a month, we have had a practice and a policy that we need to use the ear loop face masks in clinically facing areas unless the patient's condition requires us to do more than that. But we're still seeing cloth masks in clinically facing areas. And so please remember that policy. It's the ear loop masks provided to you that we want in clinically facing areas unless you need to do more, which is your N95, but certainly not the cloth masks in clinically facing areas. In other areas, you're welcome to do that. So please keep up to date on the breaking news, because that'll share with you what you need to do. So as we go forward, the Shands Gainesville Hospital is busier. We know that it is. But in some sort of interesting way, as we've had this surge up to 47 COVID patients, there's an eerie, but maybe not eerie, calmness that I think we're starting to figure out how we continue to do what we do with growing numbers of COVID patients. And I think there's an internal awareness, maybe a gut awareness, that this is going to be with us for a long time, if not forever. And so people will figure it out. Thanks for all you're doing. I know it's complicated. I know it can be nerve-wracking. I know that there's a lot on your shoulders here and at home. So I do appreciate it. Thank you for all you're doing.